MAD device provides a very low-resistance airway compared to the mouth. Breathing through this device can reduce the high inspiratory pressures generated in people with nasal obstruction. Only this novel device advances the mandible, tongue, and opens the airway while bypassing soft tissue obstruction such as soft palate collapse and nasal congestion, reducing collapsibility while maintaining an oral seal and stable jaw position. This novel device advances the mandible, tongue, and opens the airway. Use of the O2 vent optima by a patient enables stable ventilation and normal sleep.